Welcome to Well-Rounded Mama's YouTube channel. I'm Sherry and this is Sarah, and we are midwives down here at Well-Rounded Mama. And thanks for joining us. Like, subscribe, ring the bell. We were just talking recently about how we want to buy a cowbell.
We need more cowbell.
We need more cowbell. I think we should buy one for Tori for Christmas.
We should.
Today we're going to talk about what happens when you tear, how do you prevent tearing, what happens to your vagina / yoni / hoo-ha / all the words. What if I tear? That's a big concern.
Yep.
Today we wanted to talk to you a little bit about, can it be prevented and how can you help it heal? Let's talk a little bit about pelvic floor. I would say during your pregnancy, one of the best things that you can do to help prepare your body is some type of core strengthening. Even though we spend all this time talking about the perineal muscle, so that is generally where women tear. If this is the opening to your yoni, and this is your rectum back here, this right here, there's a word for this that starts with a T, but we're gonna call it your perineum. And so this is what your perineum is. And so that's the main aspect that tears. However, your entire pelvic floor plays a crucial role in, I can't even talk today. What happens is everything kind of has a job when it comes to your pelvic floor. And so I think some kind of exercise.
Yep.
And so what kind of exercise do you tell your clients to do? I
mean, they can do Kegels, you can do squats, you can do prenatal Pilates is really good. We happen to have a Pilates teacher here who actually specializes in pelvic floor and diastasis recti, which is fantastic. Her name is Emily, so look her up. Really, if you Google any sort of pelvic floor exercises, all of them are good.
My top 3 favorite exercises for pregnancy would be yoga, Pilates, and swimming. Those would be my top 3. However, what I just talk to women about doing is doing something for 30 minutes every day. I don't care if that's walking, running, going to the gym, taking a class. Now there's so many different apps that have you do little exercises. There's even prenatal ones. 30 minutes of movement. The thing about that is there's so many reasons it's helpful. It helps your back, it helps your core, it helps your posture. And I do want to take a quick little moment to talk a little about Kegels. And so the Kegel exercise is when you're peeing, so let's make this like super simple. When you're peeing and you stop that flow of pee or urine, that's your Kegel. If you have to do that to find that muscle, but you shouldn't be doing that while peeing unless you want a UTI.
No one wants that.
Are you in the market for a UTI? I can tell you how to get one. So what we have learned though is it used to be that we used to just tell women to tighten that muscle, but what we have found is that causes more problems. The new trick to the Kegel is this idea of kind of squeezing that muscle together slowly and then turning and releasing that muscle just as slowly. Even if you were doing that, 20 times a day, sometimes I'll hear stories of women doing it at stoplights or...
Well, and associating it with an activity is a great way to get them in.
So let's talk about the controversy, perineal massage.
Not a huge fan.
A lot of childbirth classes talk about perineal massage. So this idea and this concept that if you stretch and massage your perineal muscle, just as you would prepare to run a marathon or a race, you would prepare that muscle. But that's not really our belief, I guess. I think every woman should know where her perineum is.
Sure.
I think that if she wants to feel what it feels like to have pressure, so again, I will use my hand because we didn't bring the pelvis in here. Why? We're talking about tearing. Never more than 2 fingers, never past this first knuckle, right? So like if you were to take those and you wanted to put some counter pressure to feel what that felt like as that was stretching on either side, you could also do it technically on your mouth. It would be the same sensation.
Well, and I think that a lot of people, they just think that there's something that you have to do. My mom, and I think especially my grandmother's generation, they used to be told that you had to toughen up your nipples before breastfeeding. Like this similar mindset of that you have to prepare your perineum for birth.
Yeah.
And it's just not proven to be true.
But I think how you create a healthy pelvic floor is 30 minutes of movement every day and eating well. It's getting healthy fats and keeping your cholesterol healthy, all of that. Even though we think about how that helps our insides, it also helps the
It helps
skin
our
on
skin.
our outside. So that's kind of our 2 cents. It's just not something that needs to go on your to-do list. I would rather see you eating well and getting out and moving for 30 minutes every day. For preventative, that's it. Are there things that they could do during labor that could help potentially prevent a tear?
Slow, controlled pushing. There's some evidence that upright birth actually had a little bit of an increase in tearing, according to evidencebased-birth.com.
So did water birth, actually.
And I think it's just that slow, controlled descent. As the baby starts to crown, like you really want that slow, like rocking motion of the baby coming under that pubic bone and putting pressure on that tissue and then kind of easing off, which happens with coached pushing. Not that I think that all births should be coached pushing, not at all. But when your baby starts to get that low, like taking that moment to breathe and allow that tissue to stretch, I think that's where it's at.
Like if this is your pubic bone and this is the baby's head, what's happening is this baby comes down, baby's coming down under that pubic bone, and the baby's going back. And the baby's coming down and coming back. A lot of times we just kind of want to see that baby come out, right? What happens is instead of this kind of gradual, kind of slow moment, is you're just pushing, and then that's staying, and that's pushing through, and then it's pushing through, and then it's pushing through. And so you don't have that ability for that body to recover. And so I always tell women the recovering is just as important as the pushing, and taking that moment to relax, recover from what just happened, and then going back into that. It's just like that careful dance of allowing the body to do what it wants, but then sometimes a care provider does have to step in and kind of go, okay, I'm going to help manage this a little bit to prevent a tear. So sometimes I'll use like a hot compress. Same with olive oil or mineral oil or whatever they use. So it's just like a lubricant. Staying well hydrated plays a role in that.
And sometimes having mom's hand down there, that tends to slow down that roll too.
I think that's a really good point to bring up, is reaching down and feeling your baby, feeling what's happening to your body. And so let's talk a little bit about the types of tearing that can happen. You have first, second, third, and fourth degree tear. You also can have abrasions. So let's start for that. You can have an abrasion initially. That's just a skin. That's like if you fell and you skinned your knee, but it's not like an actual cut. But it's stretched to a point where it has that kind of abrasion kind of feel. And then you get into your first degree, which is skin, superficial. Your second degree starts getting into muscle. And if you can imagine, that just gets deeper and deeper. Your fourth degree is actually through your rectal tissue. It's really uncommon that we see fourth degrees. I think I've had 2 in my entire career.
It's very uncommon without like an instrumental delivery, meaning using a vacuum or forceps. It's pretty uncommon for especially a natural delivery for that to happen.
So second degree is probably the most common tear that you can have, and usually that's perineal. Obviously it can be other things as well. To suture or not to suture. Sutures hold the skin together so that it might heal and do its job. It doesn't in and of itself heal your body. Okay, that's something your body does on its own. So when you go in to have sutures done, that's the trick. The trick is, how do you hold the skin together? Some of the problems with stitches is now you have a foreign thing in your body that your body needs to get rid of, because those sutures are dissolvable. A lot of times that's the complaint of women, is they feel that pulling of the stitches, or they can itch as they're healing. And so a lot of times it's between you and your care provider making that decision of whether you want to be sutured or not. I think you probably have less options in the hospital, like a physician's gonna...
They just assume
that's what you want. Like a lot of our physicians here suture abrasions. If it sits together well on its own, ideally we would just want the skin to do it on its own. And however, that is always the risk of not, is like if you did too much and you weren't willing to stay down, or you had like something that prevented that from sitting together, you might potentially have an issue. But once you start getting into the muscle it's not laying together very well, you have to have, the only way to do that is either with stitches. We also use seaweed down here. Seaweed works really well as a binding agent. We like seaweed a lot because when you're done with it, you're done with it.
Especially for those like first degree or like...
It's just not quite sitting together the way we want. And so kind of making that decision. Obviously third and fourth degree, you're talking about major reconstructive. As midwives, we don't even deal with third and fourth degrees. We have to turn to doctors and surgeons to kind of help with those. Let's talk a little bit about healing then. Say that tear does happen and you're healing from those stitches.
First and foremost, you get this little squeeze bottle in your postpartum kit, making sure that when you go to the bathroom, you definitely utilize that little squirt bottle, that peri bottle. That'll make going to the bathroom much easier. Anything that's going to help soothe that area. I know there are sprays that have like witch hazel in them. We do have some here in the store as well. Some people will even use like a healing salve or balms. Those work really well for those first and second degrees, where we're talking about more of like that superficial tissue that's healing. If you have like deep muscular tears that need to heal, it's probably better just to use like a spray or just do like Epsom salt baths and sitz baths and things like that, because that can help soothe those muscles and kind of help with pain.
I'm a huge fan of Epsom salt baths. And so sitz baths are really great.
Yeah.
So when we talk about an Epsom salt bath, we're talking a minimum of an entire cup.
Yep.
Right? So we want it to legitimately be
Salty water.
I think we spend a moment kind of referring back to that whole baby moon video that we did, which we'll link up above. I think because we have menstrual cycles as human beings walking this planet for fun, when we are bleeding postpartum, we think of it as a normal kind of experience that's happening.
Yeah,
and
that we can just push
yes,
through.
what I always tell women is that placenta that comes out, if you look at it, I always make women look at their placentas. It's so gross. It's generally about this big, and that is the wound inside of your uterus. It's a wound because that placenta was attached to your uterine wall. It's now detached. That's what you're bleeding from. You're not having a menstrual cycle. Keeping in mind, like if that was on the outside of your body, you would be very cautious of what you did or how far you pushed it. You would allow it to have the time and the ability to heal.
Same with stitches. Like if you had stitches on the outside of your thigh, like you'd be careful.
So anything else?
Ice, lots of ice packs, frozen like chamomile tea pads. Well, usually just panty liners are good.
I do the same thing. I tell people
I like
panty
panty liners.
because remember, it's not necessarily the coolness. The coolness is an anti-inflammatory and it's soothing for you, but it's actually the chamomile tea that makes it really do its job.
It's anti-inflammatory.
Yep, panty liners are great. And I make them so quick. Like all you do is you just grab a cookie sheet, you throw about a dozen panty liners on the tray, you brew a really super strong chamomile tea, and then you just pour it over, freeze it, and now you've got them.
And keeping the backing on them, the paper.
Yes, that helps separate
That can
them.
kind of separate them.
That being said, we really don't see that many tears, especially when women are kind of doing their homework and putting the work in during their pregnancies. Share with us down below, did you tear? What helped you the most postpartum? What tips and tricks did you find that helped you kind of heal well? So thanks for joining us. Like, subscribe, ring the bell, and we will see you next week.
I wasn't prepared.
Yep. Yes. It's shocking that I don't just pee all the time.
Start filming, so if we capture any funny stuff, so
Don't be funny,
be
Sarah.
funny.
You can tear labely, bye-bye, baby. Like, because you can't see, right? I'll do a Kegel for you right now.
Anytime you answer a phone, do a Kegel. Like, whatever, right?
Oh, yeah. Don't say the phone thing. We'd just be like, whoa. I'd have like the strongest, you could bounce a quarter off of that. And so, we won't let you know how hippie we are.
Let's take a poo. Bam!